for cosmesis, because when the sutures are eventually removed, this will flatten out, and again there'll be no dimpling, no shadowing effect. The horizontal mattress suture is used only on the palms and the soles, and this is used because it is twice as fast as a vertical mattress suture. It can be used on these surfaces because the epidermis is so thick, it doesn't matter that the eversion does not result in approximation of the epidermis. This is performed in this manner. The needle is inserted, similar to a simple interrupted stitch, and instead of entering here and exiting here as one would for a vertical mattress, the needle is moved over as if the next stitch is being performed, entering there, exiting equal distance on the opposite side, and then the tie occurs on the string, not across the wound itself, again resulting in eversion, but the eversion is not as neat as with the vertical mattress because the epidermis does not touch. Again, on the soles and the palms it does not matter because this is devitalized tissue. And again, it's very fast and efficient for those two locations. Y or V laceration mattress sutures are effective in preventing necrosis of the tip of the flap. In a laceration such as this, where there is a Y formation, one is tempted to insert the needle through the tip and then through one side of the laceration. The problem with this is the very tenuous blood vessels at the very end of this flap will be compromised because of the pressure applied by the tied suture. To prevent this, we use the Y or V laceration mattress suture. And this is a very handy procedure. You enter on one side of the base of the V or Y. You then subcutaneously traverse and then exit directly opposite on the other wound margin. Now, as you can see, that can be performed with just one motion. When this is tied, there is no pressure on the blood vessels at the tip because the actual tip is not involved, only the subcutaneous tissue. And this ends up with an excellent closure also. Figure of 8 suturing is excellent for scalp lacerations when there's bleeding because the blood vessel that is bleeding has pressure applied by the figure of 8 suture, and it's applied like this. You enter on one side of the wound, exit at an angle on the opposite side, not directly across, and then you re-enter directly across from the original insertion and cross over, exiting across from the second area here. So what you've created is a figure of 8. When this is sutured, you end up with some degree of eversion plus